Welcome to RT.com. I'm Chris Sweeney, and today I'm joined by Sonia Elijah, who is one of the spokespeople for a group called Holding the Line, which is Journalists Against Covid Censorship. We'll just maybe check in with Sonia first. How are you, Sonia? Thanks for joining us today.
Thank you, Chris. I'm doing well. How are you doing?
I'm very well, thank you. Very, very well, thank you. Tell us a little bit about the organisation, because maybe some people maybe haven't come across it. You're a group of journalists that have come together because you feel that COVID, news about COVID is being censored.
Yes, that's right, Chris. Unfortunately, we feel that there's been only sort of one official narrative, COVID narrative, that has been pushed onto the public through the media. And we are a group of about over 20 journalists. We cut across from sort of few of us that work full-time in the mainstream media, others are freelancers. I'm an independent investigative journalist, and we have others like myself. So yes, we feel that, we just feel that there hasn't been, the whole story has not been fully covered, just sort of one narrative has been pushed forward. And we feel that the public deserve to know the whole picture of exactly what is going on. And as a journalist, that's, one of our, our role is to present all the facts, not just select a few. So we formed early this year, we encourage like-minded journalists to join us, or former journalists. They can email the group at journalists against COVID censorship at protonmail.com to learn more about us.
In terms of, the actual process, so, talk about that maybe. You're sort of bringing stories to certain platforms, yourself and your fellow members, and are the platforms or the newspapers, the publications, are they refusing to run them, or are they wanting to take parts out that maybe go against COVID messaging? Is it a complete block, or are they just trying to censor what you're saying?
I mean, I've been fortunate to write for, the Conservative Woman, the TCW, and they've been great because they've been one of the few platforms that have really promoted, the telling the whole truth of what's been going on. They're a great platform for independent journalists like myself, but others that have perhaps are working in the mainstream media have found a lot of their stories being blocked or censored, or just literally just not getting published. So it is a problem. I mean, we're launching a website soon, and we're hoping to put our own content on there as well.
It's not just it isn't just a British problem. I know obviously you're based in Britain, but I mean, yourself, you had an interview that was up on YouTube, and then YouTube brought it down. It was with a doctor, Robert Malone. Is that correct? And I think it was up for 3 hours, and then YouTube took it down. Yeah.
Yes. Thank you for reminding me about that. Yes. Yes, so I had the privilege to interview Dr. Robert Malone. I'm one of, I think, the only UK journalist to have done so as of yet. And so I posted it on YouTube, and Dr. Robert Malone is a vaccine expert. He is the inventor of mRNA technology. He's undergone systematic attack, literally his whole profile, his history is literally being erased online. When I posted the interview on YouTube, I think within 3 hours it got taken down for violating their policy. And there was nothing in that interview that was to do with any kind of conspiracy theory or anything. It was all very fact driven. He was very measured in his responses, but because he mentioned the adverse events happening with people having adverse events from taking the vaccines, that's probably one of the reasons why it got taken down. We also mentioned the Trusted News Initiative, which cuts across big tech, big media, which is doing a lot of the sort of fact checking. And it's just interesting, these fact-checking groups, for example, factcheck.org, they claim to be independent, but they're funded by an organization that holds over $1.8 billion of stock in a vaccine company. So, you know, you just have to ask these questions. And I feel a lot of the mainstream media, the journalists are not asking the questions, and the public are missing out on a lack of information, a lack of knowledge. I can talk about the science of just, you know, for example, if you take masks, you had Professor Jonathan Van Tam in the beginning, in one of those early parliamentary debate briefings, when the pandemic first broke, he was saying over his 15 years of experience, there's been no evidence of masks preventing any transmission of a virus. And then, so you had that go, and then they did a U-turn weeks later. They did a U-turn and they mandated masks. So you're getting this sort of flip-flopping happening, these U-turns, and journalists need to ask why. Why is this happening? And for example, I covered the protests, the anti-lockdown protests for TCW, and that was hardly covered in the mainstream media in the early days, the protests, the anti-lockdown protests. So you have, and if they were covered by the BBC, they were covered in sort of, these are anti-vaxxers, these are conspiracy theorists, and they're a very small group. There is only a few thousand, when actually I have attended one of these protests to report on it, and there were like hundreds of thousands of people there. So, and they were from all different backgrounds. You had families, you had young people, old people. A lot of them were protesting about the introduction of vaccine passports, and were sort of, so then you have, I mean, I've done also a lot of investigative reports on the testing for COVID. So I've done one for the PCR test. I did a 3-part report looking at that, showing how the PCR test was never designed to diagnose an infectious virus. Dr. Karen Mullis.
Is the PCR one, is that the more expensive one? Is that the more sort of formal one? Yeah, because I think you've got the lateral flow and we've got the PCR, but you've looked into both, so maybe you could you continue. Maybe, sorry to interrupt you, continue, but it's just maybe I think just to make that differentiation for people, just so they know, the PCR is the more kind of formal one, the lateral flow is the kind of the quicker one, where you get the result, I think, within 20 minutes sometimes.
Yes. So there's two types of testing. You have the PCR test, which is done in a lab. And then you get the results, I think, 24 hours or 48 hours later. And then you have the rapid antigen tests, which are the lateral flow tests, which have been done in they've been given out in the UK schools, hospitals, places of work. And they are rapid. So you get the results within 20 minutes or so. And it's like a pregnancy test. These are self-tests that you can do yourself. So, for example, if you take the lateral flow test, the rapid antigen test, these tests are produced in China by Xiamen Biotime Biotechnology. They're actually the original manufacturer, but they have been sort of rebranded by Innova, which is a US startup company that has had no background in any medical, in the medical field. And they were started up just around the time when the pandemic started. They're wholly owned by Pasaka Capital, which are a venture capitalist group funded by a US Chinese billionaire. And the government, the UK government, has spent £3.2 billion worth in procurement, in buying these tests. And the Innova lateral test was then rebranded by the NHS. So if you have school children were given these test kits, if you open them up, there was, they're branded as NHS, but this is the history behind it. And they were proven to be highly inaccurate, very unreliable. They actually gave both, they had for false positive rates and also false negative test results as well. You had the likes of professors like Alison Pollock, Professor John Deeks, who are warning the government in the early days, this is last year, to avoid doing the mass testing of the asymptomatic, the people that had no symptoms, that it was going to be chaotic, it was going to be actually quite dangerous and misleading because it was going to lead to sort of false positives or false negatives. And they were ignored, they were sidelined, and the government went ahead with purchasing vast amounts of these test kits before even Public Health England had even published their report on these tests, on their evaluation of these tests. So they started, I think last September was the first deal done. And they literally have spent billions on them, and they've been a complete, I would say, complete waste of money, waste of taxpayers' money. And that hasn't been highlighted in the media. But the biggest sort of scandal is that, in a way, the FDA, about a month ago, they came out and said the intravilateral flow test needs to be thrown in the bin. It's rubbish. And our equivalent in the UK, the MHRA, ignored that, what had happened in the US, and they've continued to extend their emergency authorization use for these tests. And they're saying they've done their own assessment, they're satisfied with their findings, but they're not publishing their findings, their studies. So there's like, you know, we're not knowing the full picture. We're not knowing, they're not being forthcoming. And you just have to, you know, there's so many sort of, you know, I would say scandals, and it is, and the people who've benefited from all these contracts, you know, you have a few companies that have made billions off of the testing. Yeah.
So, but I mean, you know, just to recap, I guess, on the group and what you're doing, you're not sort of saying that COVID doesn't exist. You're not saying that, you know, you're not saying don't take any vaccines, or, you know, don't take anything, don't do this, don't that. You're just saying there's another side of the story that maybe you're not aware of. Because I think maybe people are a lot assuming that, you know, you're anti-COVID, or you're claiming it's a conspiracy theory invented in China and all that kind of stuff. You're more challenging the facts as opposed to the situation.
Yes, we are challenging the facts in the sense of the whole picture needs to be presented, not just a selected a few facts. It needs to be the whole picture. So, and as I said, the public deserve to know we are not an anti-vaccines. We're not, you know, of course the virus exists. It is it's a horrible virus, you know, but I just feel that people need to know the whole story of what's going on. And there needs to be more questioning going on, as opposed to just following the government narrative all the time. And it's the public that are suffering from that.
Yeah. You know, do you feel as though the questions are not being asked for financial reasons, or do you think it's maybe a sort of a compliance thing where I think some people assume that the government and the state would like people to be more compliant and, you know, follow orders and do things easier? Do you think that's a consideration, or do you think maybe, like you're saying, there's billions to be made maybe behind the scenes that is also a part of this? Is that a two-pronged approach?
Well, I think you have to look at who funds the mainstream media, you know, who's funding it, the amount of advertising revenue they make, their sponsors, and you know, a lot of them don't want to bite the hand that feeds them. Right. That's why you have the independent platforms who are relying on people, you know, donating or whatever, but they have the freedom to tell the whole story. They're not being restrained. Whereas I think in the mainstream media, you know, you have to sort of follow the money trail a little bit.
And also, I mean, I think that sort of ties into some of your members who are anonymous. You know, they can't come out publicly and say who they are because they'd probably lose their jobs, which I think in some ways goes against journalism. I think if you're maybe have a view, or you have evidence, or you have people talking to you and telling you something, if you can't present that to your audience for fear of losing your job, I think people would say that's a very dangerous thing, particularly in a country like Britain.
Yes, well, you're talking about censorship, aren't you? You know, and it's very unfortunate that we're in that. I mean, like I'd mentioned, you know, you have the Trusted News Initiative that's been held by the BBC, and that cuts across big tech, big media, and there's a war there's sort of a war on information going on right now. And it's a shame. And for journalists to be sort of gagged in a way of like, you can't say this, you can't, you know, it's, you know, we need to level the playing field. And that's sort of what we are promoting, best journalistic practice as a group. And we feel there needs to be more room for a balanced debate. And that's what's been sorely missing in this whole COVID sort of world that we're in now. There hasn't been a balanced debate. So it's very, very sad.
And has it gradually got worse, or has this been the state of play since we sort of saw this happening in your experience? How have you felt it ratchet up as COVID has become a bigger issue? And I think a lot of us thought, what is it now, 18 months? I think a lot of us thought we would be with this maybe only last a couple of months, but 18 months, 2 years down the line, we're all still living with it.
I think it has been ratcheted up, I think. And for example, even if you're looking at the vaccines, it's sort of, there's been no sort of real spotlight given to, well, you know, adverse events, or should we be it's the way people are being coerced. I think that is just a bit troubling. And there hasn't been enough sort of questioning behind that. Why is there this coercion? And that's very worrying. And I think that's been really ramped up. But in some ways, for example, even the sort of lab leak theory, which has been discussed now in the mainstream media, but 6 months ago, that would never have been discussed. So in that sense, that's good. A few, you know, there is a little bit more of debate going on there. And you've got the launch of GB News, and they've been pretty good with doing a lot of debates and questioning. So there have been new platforms that are sort of coming out of this. But yeah, I think the public are hungry to know what's really going on, and it's our role as journalists to present all the facts and to do the research and to present it all. And again, like I said, and not just be selective.
Yeah, I mean, at the start there we mentioned YouTube. You know, your own interview been taken off YouTube. I'm just going to ask you maybe about the other ones, so sort of Twitter, Facebook, TikTok, Instagram. Have you run into similar roadblocks with these? Because obviously these are global things where you can reach a huge amount of people with a single post.
Yeah, I mean, I haven't been blocked from Twitter. I use BitChute a lot to post interviews as well. And I had a feeling even when I posted on YouTube, I had it in my mind, I'm thinking, I wonder if they'll take this down. And I sort of said, well, probably maybe in a week's time they'll take it down. But I was shocked when it was in a matter of hours that they had taken it down. But this is it, you're getting these scientists coming forward like Dr. Robert Malone, who are being completely sort of blacklisted, sort of pushed against the sidelines. And that's what I'm saying. Even only one scientific truth is allowed, you know, and that again is dangerous territory when you have many scientists coming out speaking against, you know, whether it's, you know, the ills of lockdown, about the masks, how, you know, there hasn't been one randomized control study to prove that masks are effective in preventing transmission of the virus. The only one that was done was in Denmark that proved that masks were ineffective. But that hasn't, you know, that's been quiet on in mainstream media. You've got the Great Barrington Declaration signed by very eminent scientists, medical professionals. Tens of thousands of scientists have signed this declaration, but that's been completely downplayed. And that was, you know, you've got Dr. Sunitra Gupta, who was who'd launched that. Then you have, I wanted to also mention the early treatment for COVID has been completely suppressed. And I think that's a really good example of, again, the suppression or this sort of ignoring, you know, choosing to ignore, for example, ivermectin. And you have Dr. Tess Lowry, who's done so many studies and tests and have proven that this is such an effective drug. and a very cheap drug that doesn't have a patent. And that's just been completely sort of ignored, the early treatment.
Well, I mean, I've got to say, I know nothing about that. So maybe you could tell us. So is that something when you first get COVID, you would take this drug and it would help you out? Is that,
yeah,
it would alleviate the symptoms?
Yeah, it's like an anti-parasitic treatment. And it's been proven in many countries. And I know in India, they were using it a lot, and cases came way down. And you have the likes of sort of doctors, and a doctor in New York that did, like Dr. Zelenko. He had a ivermectin protocol with a mix of, vitamin C, zinc, some antibiotics, and but ivermectin has been proven to be, I think death rates fell by 70%. This is a Dr. Zelenko in New York, again, this has been sort of downplayed, but they have proven, it's been proven time and again that it's very effective. But you can't even get it, so you can't even get it in the UK. I don't, it's a very hard to treat COVID. I mean, I don't know if any GP will prescribe it here.
And in your view, it's all coming back to money. It's all the media people are being supported by certain financial backers who maybe have something to lose here. And like you say, don't bite the hand that feeds. It's really not about truth or news or facts checking. It's more about money.
I think money has not to be, to be a bit cynical, I guess, money makes the world go round, doesn't it? And you just have to question it. I'm not going to come out and say, oh, it's because of this, because of that. Obviously, I don't, but you question and you think, well, why? Why is this happening? And why is it sort of this sort of funnel effect just for, only the vaccines are our way out of this pandemic, when actually it's been proven now, more and more cases where you have in heavily vaccinated countries, you have a real surge in COVID cases going on amongst the vaccinated. And that's a fact. That's happened. So surely then the vaccines then are not so effective well, actually they can't prevent the infection, but their efficacy rates must be a lot lower than what they have been originally, sort of what their original claims are. So because you're getting surges in COVID in countries like Malta, Gibraltar, the Seychelles, obviously Israel. These are heavily vaccinated countries. Yeah,
and your appeal would be that you'd like to see all this data, you'd like to see all this information, and you'd like to look through it. You're not looking for some sort of secret whistleblower to give you some top secret file. You would just like the stuff put out in the public domain for someone like yourself to go through and then report on.
Absolutely, yeah. The data needs to be. We need to see the data.
And in terms of your own personal reaction, I mean, your colleagues, because you're not criticising them, but obviously you are sort of labelling some criticism at the industry. What sort of reaction are you getting from your fellow journalists, maybe in these organisations? Are you getting a fair bit of heat, or are you getting quite a lot of support that maybe you didn't expect?
We're actually getting a lot of support. We're getting a lot of emails through, a lot of journalists who want to join the group. So, that speaks for itself.
Yeah. And finally, your advice to the public then, you're saying that they're only getting one side of the story, what is the best way for them to inform themselves, do you think?
I think doing their own research, finding out, doing their own research and just to question more, to question and not just rely on, okay, the BBC as like, that's the gospel truth, whatever they say, you've got to question more and go onto sites like, TCW, Conservative Woman, you've got some other great sites too. So it's just doing your own research and sort of, and not just relying on what the facts that they're giving you, to always question.
And does it worry you? But I mean, does it worry you maybe these smaller platforms, they're not less important, maybe sometimes smaller. I think people always assume that, oh, well, they're not telling us the truth. The bigger platforms are telling us the truth. You've always got that battle, haven't you, in a way? It's always that, I don't want to say credibility, but that sort of perception battle.
Yeah. No, it's true. I mean, that is that. But I think out of all of this, I think there's going to be you're getting a lot more independent journalists speaking out. And I would even call them sort of citizen journalists. It's sort of, you're getting a rise in that sort of people that are sort of dissatisfied with what they're hearing on the news or the mainstream. And then they're doing their own research and finding out all the facts, so they can get a bigger, the whole picture, as opposed to be just getting a little piece of the puzzle.
And Sonia, I'd also like to ask you about SAGE, because I know you've written about them, you've got opinions about them, and they are, for anyone who doesn't know, they're the Scientific Advisory Group for Emergencies, and they essentially provide information and recommendations towards the government, but they're not elected officials, they are separate from the government. So can you maybe tell us about your concerns about them and your how you feel they've impacted this situation?
Yes, I think on the I wrote a report, an investigative report called SAGE's Covert Coup early this year. And so you have the way SAGE is divided, you have the subcommittees, you have SPIB, which are the behavioral scientists, and then you have SPIM, which are sort of the mathematicians, statisticians, the likes of Neil Ferguson with their modeling predictions. And unfortunately, I feel that the UK public have been part of a mass behavioral science experiment. And when I say that, it's because these behavioral scientists know full well the power of fear when you use fear, and how you can really control sort of someone's sort of behavior through fear. And I really feel that fear-mongering has really gone on in the media with the use of sort of, the government's sort of Project Fear sort of advertising campaign that they did earlier on about if you leave your house, people can die. And they did a big campaign with Look Me in the Eyes campaign. If you look at the early meetings that SAGE did last year, and in the minutes of the meetings, you can find this straight off the government website. They did look at a tool where they looked at, use the media to increase sense of personal threat. So the media were used as a tool for fear mongering, and that's a fact. I mean, you just look that up. So you have them looking at coercion, techniques of coercion, how to get the young to sort of follow the rules. This was in the early days. And this was during sort of the hard lockdown months. And again, this sort of, the use of fear has been really unprecedented, I would say, in this sort of the way the government has dealt with this. And that's awful, because people were so scared that they didn't even leave their homes. They didn't get the medical treatment they needed because they were too scared to go to hospital. And, you have people that died. They died in their homes because they died of other medical reasons, not to do with COVID. I think the Telegraph did a piece last year, where they sort of said that probably there was at least 200,000 non-COVID deaths because of these lockdowns. I believe lockdowns have been disastrous, catastrophic, school closures as well. You have a whole generation of children who've missed out on a proper education, who were just forced to go online, those who could afford and have laptops at home. This has been to the detriment of their mental health, their emotional health, their well-being. So you just have people just suffering because of these COVID policies that have not helped. And you look at countries like Sweden that never did hard lockdowns. Their restrictions were very minor, and they didn't have hundreds of thousands of people dying. They did very well out of it in that way. So and it's a real shame. So yeah, I think fear mongering has been really awful. It's just can't speak strongly enough against my my opinion on that. Yeah.
And finally, you were very generous with your time. My final thing was to ask you also about the sort of crowdfunding, because I think that's something you were mentioning there for yourselves and organisations like yourselves. But I think that's great for journalists, because it means that a journalist can almost be free of commercial or, you know, their salaries coming directly from their audience in a way which is a good thing. And maybe this type of citizen journalism and people wanting to find facts may drive that more, which I think can only be encouraged in a way when you've got people out there sort of steering their own ship, if you want.
Yes, definitely. You know, definitely in a way, sort of the journalists can be their own editors, as you know, that it's sort of whether you self-publish or you use sites like Patreon, you know, and there's a Substack, you know, there's lots of the sites coming up where you can generate, you know, finances there, and you'll sort of you have the freedom, right, to write what you want to write.
Okay, brilliant. Well, thank you so much for your time, Sonia. Just before we go, maybe you can tell people, you know, where they can find your stuff, because if anyone's wanting to, Sonia's alluded to, she's done a few investigations on the vaccine, she's done on the testing. So, you know, where can people maybe find your stuff and see what you're talking about? You know, where can they find you before it's removed by the internet?
Well, they can follow me on Twitter. I do post a lot there at Sonia_Elijah. I've got a lot of work posted, theconservativewoman.co.uk. They've sort of rebranded their name as TCW. I also write for News Africa magazine. I've got a big report coming out soon on looking at the surging COVID cases amongst the vaccinated coming out. Yeah, I encourage anyone, like-minded journalists or former journalists, to get in touch with us at Journalists Against COVID Censorship at protonmail.com, and we hope to be launching our own website soon.
Well, thank you so much, Sonia, for your time. It's been a pleasure. Thank you very much.
Thank you. Take care. Thanks. Bye.